Welcome to the Defeating Epilepsy Foundation YouTube channel. In this presentation, we will discuss what transgender is, statistics on transgender people, being transgender in the American healthcare system, transgender care and epilepsy, and resources. Make sure to like our videos and subscribe to our YouTube channel. Click on the bell to be notified of future videos. Please click on our donate link in the description section below and donate today. Your donation helps us make a difference for those battling epilepsy. We appreciate your support. According to the American Psychological Association, transgender is an umbrella term for persons whose gender identity, gender expression, or behavior does not conform to that typically associated with the sex to which they were assigned at birth. According to the Williams Institute at UCLA Law School, 1 in 5 people who identify as transgender are between the ages of 13 to 17. In June of 2022, the Williams Institute released the report, How Many Adults and Youth Identify as Transgender in the United States, using data from the CDC's Behavior Risk Factor Surveillance System and Youth Risk Behavior Survey. Researchers gathered data, and we were able to find that over 1.6 million adults and youth identify as transgender in the United States, or 0.6% of those ages 13 years of age or older. Among U.S. adults, 0.5% identify as transgender. Among youth ages 13 to 17 in the U.S., 1.4% identify as transgender. Of the 1.3 million adults who identify as transgender, 38.5% are transgender women, 35.9% are transgender men, and 25.6% reported that they are gender nonconforming. Research shows transgender individuals are younger on average than the U.S. population. We find that youth ages 13 to 17 are significantly more likely to identify as transgender than adults ages 65 or older. The racial ethnic distribution of youth and adults who identify as transgender appears generally similar to the U.S. population, though our estimates mirror prior research that found transgender youth and adults are more likely to report being Latinx and less likely to report being white compared to the U.S. population. Our estimates of the percentage of residents in the U.S. regions who identify as transgender range from 1.8% in the Northeast to 1.2% in the Midwest for youth ages 13 to 17 and range from 0.6% in the Northeast and 0.4% in the Midwest for adults. At the state level, our estimates range from 3% of youth ages 13 to 17 identifying as transgender in New York to 0.6% in Wyoming. Our estimates for the percentage of adults who identify as transgender range from 0.9% in North Carolina to 0.2% in Missouri. Many people who are transgender are uncomfortable seeking medical attention due to the fact they face stigma and discrimination in society. According to the article, Barriers to Healthcare for Transgender Individuals, the biggest barrier transgender people face is the lack of access to care. Many face challenges in having their hormone replacement therapy or sex reassignment surgeries covered. More health plans are expanding their services to cover these procedures, yet challenges remain. Under Medicaid, some states are refusing to cover gender transition services. In some situations, a health management organization may be willing to pay for services. At the same time, the medical group an employer chooses will not cover the services, resulting in the person being denied. Because of these challenges, many nonprofits focused on advocating for the LGBTQIA+ community are working towards helping members of the community receive treatment. In Los Angeles, the Los Angeles LGBT Center helps individuals in the community gain insurance coverage, gain access to medication, mental health services, and more. Organizations such as the LGBT Center provide an environment in which members feel safe, comfortable, and confident that they can receive the medical care they need without facing discrimination. Individuals with epilepsy may be already facing challenges finding the care they need. Transgender people who have been diagnosed with epilepsy can face greater challenges due to the additional stigma. Another challenge is the effects that anti-convulsant medication can have on hormone therapy. In the article, Epilepsy Care in Transgender Patients, Gender-affirming hormone therapy can interact with anticonvulsant medication and may decrease hormone levels, interfering with treatment. It is important for individuals who are transgender to obtain access to resources. The following organizations help individuals who are transgender. Transgender Law Center. The Transgender Law Center is the largest national trans-led organization advocating for a world in which all people are free to define themselves and their futures. The Transgender Law Center helps people advocate for justice, whether it's employment, housing discrimination, healthcare, youth services, and more. GLMA, Health Professionals Advancing LGBTQ Equality. GLMA provides information for both the patient and the provider. Patients can go to the site to find a provider, information to discuss with their providers, legal resources, trans health resources, as well as information on mental health. Providers can join the organization's directory, learn how to create a welcoming environment for trans patients, as well as gain access to research information. National Center for Transgender Equality. The National Center for Transgender Equality helps transgender people find support hotlines, health care, mental health resources, domestic violence resources, immigration, veteran services, and more. They provide self-help guides as well as connect people to advocacy organizations. In conclusion, transgender is an umbrella term for persons whose gender identity, gender expression, or behavior does not conform to that typically associated with the sex to which they were assigned at birth. It is important for medical professionals to be familiar with transgender care, no matter what area of medicine they practice. Laws need to be put in place and enforced to prevent the government at all levels from discriminating against individuals who are transgender and seeking health care. Neurologists and epileptologists need to be familiar with gender-affirming hormone therapy to help prepare for a proper care plan. Organizations need to work at all levels to ensure that transgender people can have a good quality of life no matter what health challenges they may face. To learn more about transgender care in epilepsy, please check out the resources used in the presentation today. Please like and subscribe to our YouTube channel and follow us on our social media pages. We would love to hear from you. Leave a comment below or email us at info@defeatingepilepsy.org. Thank you for your support, and together we will defeat epilepsy. Check out our other great videos and subscribe today. You have the power to defeat epilepsy.